Welcome and thank you for being here with us today. My guest is Amber Rhodes, a supervisory analyst at the Office of Personnel Management. Amber, thanks for being here.
My pleasure. Thank you.
Thanks. And I'm looking forward to diving into some of the details here on this year's open season and what enrollees should be looking out for. So where I wanted to start is that we already know that FEHB enrollees on average will be paying 7.7% more toward their healthcare premiums next year. That, of course, means that some FEHB plans are increasing either more or less than that average. But what would you recommend to participants as they start to look during this year's open season?
I recommend using our plan comparison tool. You can compare up to 4 plans at a time. Also reviewing your plan brochures to see what items have changed from last year to this year, even with your current or for what you're looking for if you're looking to change, and also review the rates themselves.
So within OPM's plan comparison tool, tell me a little bit more about how that works and what information can you find when you're comparing plans?
Sure. Our plan comparison tool allows you to compare up to 4 plans at a time. You can look across the ones that you choose. It'll show you copays, the rates. You can view the brochures. There's contact information, different benefit information, different pharmacy information. And so please use that tool as moving forward. I think it's very helpful for everyone.
And aside from that, do you also, or would you also recommend that FEHB participants take a look at the brochures that different plans offer? What kind of information can you find in those from FEHB carriers?
So the brochure is the official statement of benefits. So you definitely want to take a look at that brochure. And every brochure, there is a page to tell you what has changed from the previous year to the current year. So that's a good place to look as well. And there's contact information. Of course, all the benefit information is there, and there's rate information on the back.
Great. No, that's really helpful to know. And, I know that it might be too much to go into all the different things that are available for the healthcare program next year, but maybe you can tell me a couple of the top line changes to benefits that are available to participants for 2024.
For the 2024 plan year, OPM is pleased to deliver enhanced benefit offerings and the following areas across the FEHB program. That includes fertility benefits, FEHB and Medicare coordination, pharmacy benefit design, gender affirming care treatment services, mental health, prevention and treatment of obesity, mental health and substance abuse disorders, telehealth, and antibiotic stewardship enhancements, and highlights of several of those benefits are all highlighted in the plan brochures.
And within some of those options, maybe tell me, you're working within OPM, so maybe explain, how that works. Is this something where you hear from different participants, or how do you put together the benefits package each year?
Well, the benefit packages, there's a call letter that goes out annually to our carriers, and we negotiate the benefits and rates of each year. There's some industry standards and trends that are looked at, definitely taking the feedback from our consumers as well.
And let's dive into maybe a couple of the specifics from those different coverage areas you mentioned. So with infertility treatments, what is actually going to be available to participants who might be looking for coverage in those areas?
Well, it will vary by carrier. So my advice would be to look at your FEHB plan brochure. There's contact information if you want to contact the health plan specifically to see what those benefits look like.
And then is that kind of the same for different telehealth offerings or other things of that nature, all the other ones that you outlined there?
Sure.
Great. And, I want to talk a little bit about dental and vision care as well. So in the Fed VIP or Fed VIP program, how much are those plans increasing, and how many plans are going to be available in 2024?
Well, OPM is adding some important features to the Fed VIP program for plan year 2024 while minimizing changes in enrollee premiums. So the 2024 average premium increase from plan year 23 for dental plans was 1.4%, and for vision plans, it was 1.1%. There are 12 dental plans. 7 of those are nationwide, and 5 of those are regional. And there are 5 vision plans, and they're also nationwide.
And during open season, I'm also curious, do you see different percentages of enrollees who are changing their benefits either between FEHB and FEDVIP, or do you see more changing in one area than the other, or how many people are actually taking advantage of open season?
I think a little over 1% or 2% are making FEHB and or FEDVIP or FSA changes.
And I also wanted to cover the FSA Feds program. That's the flexible spending account program that federal employees can take advantage of. What types of expenses are eligible to be covered, and who are those available to?
So FSA Feds allows you to save money for healthcare expenses with a healthcare or limited expense healthcare account. This is think of it as a tax saving account that helps you pay for items that are typically not covered by your FEHB plan or your dental and vision program or other insurance that somebody might have. So FSA Feds offers an account for families with young children or elder care expenses, and that is the dependent care FSA account. And so that account allows you to set aside money to pay for daycare expenses. And OPM is also excited to announce a major expansion of the dependent care flexible spending account to active duty service members. So that was an expansion that came about this year that we're excited about.
Yeah, absolutely. And wasn't there also an eligibility expansion for the FEDVIP program as well, if I'm not mistaken?
Yes, I believe so.
I think it was for temporary and seasonal employees, and there's going to be a lot of more people available or eligible for that program as well as the dependent care. So there's a lot of big changes coming up, it sounds like.
Yes, absolutely. We're excited about it.
And I want to talk a little bit about what might be unique to federal retirees as well in the FEHB program. For example, those who are also getting Medicare or are Medicare beneficiaries. What is available to them, and what have you seen maybe in the last couple of years change with Medicare as it relates to the FEHB program?
So all FEHB plans coordinate benefits. Almost half of FEHB carriers offer plan options that provide additional benefits and other incentives to eligible members who enroll in Medicare Part B. So the Medicare Part B incentives are generally two types, either a copay, coinsurance, or deductible waivers or reimbursement. So the FEHB plan comparison tool that we spoke about before makes this information available to enrollees. So they're able to identify that information up front.
What are some of the most common questions that you get from current federal employees who maybe are curious about FEHB?
So I think some of the most common questions that we get are what plans is one available for? So there we have options, and there's about, for our nationwide plans, everyone has 17 plans that they are eligible for. Those are nationwide plans. And then based on where you live or work, there are the regional plans that one may be eligible for. So we definitely encourage employees to look at that plan comparison tool and to look at their brochures to see what they are eligible for.
So in the plan comparison tool, then, is there a way that someone who's looking at it can filter down and see what's available to them regionally or geographically?
Yes. So when you do that, you can put in your zip code and it will pull what's available to you based on where you live or work. And also, if there was any uncertainty, the front of every brochure has the locality in which they cover. So there's always another check.
Yeah. And for federal retirees, maybe the questions that you get compared to current federal employees are a little bit different, or do you see any big questions maybe around Medicare or other things that retirees are, asking OPM about?
I think that for retirees, some people think when you retire that you're stuck with the plan that you were with when you retired. And so open season is an opportunity for everyone to include annuitants. And so they may also change as well. So we encourage them to use those same tools to look up what's best for them.
And another thing I'm curious about, Amber, I know that, OPM is working year round for the FEHB program. Of course, open season is when it gets the most attention from different FEHB enrollees. But what is your kind of yearly schedule look like, or what else are you working on throughout the year as you ramp up preparations for open season each year?
Right. So once open season ends this year, we'll go do our debrief and our internal review, and we'll take that information based on the feedback, based on our own findings, look at all of our statistics, and begin preparing for next year. We'll prepare our annual call letter that we talked about before at the beginning of the year. So that cycle is right after one ends, we're in full swing for next year.
Mm-hmm. And is that going to change at all next year with the Postal Service and that whole program, or are you working alongside coordinating that for open season in 2024 going into 2025?
We're working along that same timeline. Yes.
And with that annual call letter, to maybe tell me a little bit more about the process when you're putting together that annual call letter to carriers. Are there, are you having these conversations with carriers throughout the year? And what are some of the questions that you're thinking about as you're putting together all that information?
So for the annual call letter, like we talked about before, we are looking at industry trends, some of the feedback that we've gotten. Of course, we're conversing with our carriers, and we will go into that negotiation cycle, and proposals will be submitted, and we'll begin that negotiation with the carriers who will participate in FEHB.
And then with the premium rate increases, of course, this is something that is a big announcement from OPM each year around the September timeline. What does the process look like for putting together premium rates, or how does that compare to other large health insurance providers for how that process works?
Right. So that the benefit and rate negotiation is done at one time. So it's all bundled together. So when we go through our negotiation cycle, while we're also negotiating benefits, we're also negotiating the rates.
And during open season, let's kind of get back to this specific time of year that we're in right now. What are questions, I guess, that FEHB participants, when they are looking during open season, should be asking themselves or thinking about in terms of how they might want to make changes next year?
Absolutely. So we encourage enrollees to think about, or potential enrollees to think about, their upcoming healthcare needs, their upcoming healthcare expenses, tax savings, dental and vision changes, any upcoming life events that they may have that may impact their care or their family's care.
And what would you want if FEHB enrollees were to watch this conversation? What's one thing that you would want them to take away from it?
I would want them to review their rates and benefits for the upcoming year, no matter if you intend to change or not. Even if you're not intending to change health plans, your benefits and rates are still subject to change. So still review your plan brochure, and maybe based on information you may want to change. So I say look no matter what you're intending to do.
And I guess on OPM side as well, from that, is there anything, we know that only about 5% actually make changes during open season. So are there ways that OPM from the inside is trying to encourage more people to take a look and actually make those changes?
Absolutely. We definitely want people to go to our website, which is opm.gov/open season. Please log on, and there's great FAQs. There's some great reference and resources for people to use. So we really want to ensure that people go to our website and are able to find the information that they need. And maybe it'll help people think about what those healthcare expenses look like, what their upcoming family and self needs are. So please go to our website, opm.gov/open.
Great. And one other thing I did want to touch back to the premium rates for a moment here as well. So we talked about, that they're going to be increasing by an average of 7.7%. So maybe talk a little bit about how that makes a difference between what enrollees are paying versus the government contributions, and maybe the other numbers there that that employees will see next year?
Sure. So it is an average of 7.7%. So some plans may see a little bit higher increase, and some will see lower increases. And it's just based upon utilization, different things of that nature, and different drivers. So that it's definitely something that we encourage people to look at our website, look at your benefits, look at your rates, look at what's changing for the upcoming year, so everyone is making an informed decision.
And one thing you mentioned a few minutes ago as well is that there is kind of a myth, at least for federal retirees, that once you retire, you can't make changes during open season. Of course, that's not true. Are there any other myths about FEHB that you hear from enrollees, just like questions that you might want to dispel, or just kind of, offer some good advice here?
I can't think of any myths per se. We just want to make sure that enrollees have all the information and the tools that they need to make an informed decision. Maybe one is that, I'm happy, so I don't need to look. So I always encourage everyone to look regardless, because you're still subject to any benefit or rate changes that your plan may experience, even if you want to remain in the same plan, at least to just stay informed about what's happening with your health.
And one other big change I recall from this year's open season is that there's actually going to be a significant decrease in the number of plans available through FEHB. I believe it's dropping from somewhere over 200 down to 158 for 2024. Maybe explain the reason behind that pretty significant decrease, and to how many enrollees will that be impacting?
Sure. So that is based on the reduction in health plan choices is attributed mainly to the exit of one carrier, which is Humana, from the FEHB program, and Humana is leaving the healthcare industry as a whole as it relates to employer group coverage. So that is the attributing factor to the decreases in the choices for the upcoming year.
And if you are an FEHB enrollee who is currently in Humana, what will happen? Do you have to make an election during open season, or what happens if you don't make one?
Absolutely. So if anyone is enrolled in a Humana plan that is leaving the program for 2024, you must make a positive election into a new health plan. If one does not do that, then their employing office will place them in the lowest cost nationwide plan as determined by OPM, which is GEHA Elevate. So they'll automatically be placed in that plan.
Okay. And do you have maybe a ballpark estimate of how many enrollees that change will impact?
I believe it's less than 10,000.
And that's out of, millions of people in the program overall, correct?
Correct.
All right. Well, anything else that you think is really important for enrollees to know, going into this year's open season? Any big changes that they should be looking out for?
Well, the big changes, which is Humana leaving. So if you're in a Humana plan, definitely look at your options. Open season enrollment changes for FEHB will take place the first day of the full pay period in January. For FEHB enrollments during open season, the effective date is January 1, 2024. And for FSA Fed, you must re-enroll every year, and that effective date is January 1, 2024 as well.
Great. Well, Amber, thank you so much for your time today. I really appreciate it.
Absolutely, my pleasure.
I'd like to thank today's guest. Amber Rhodes is a supervisory analyst for the Office of Personnel Management. I'm your moderator, Drew Friedman, and you're watching Federal News Network. Now let me send you back to the studio for more on the Open Season Exchange.